Urinary incontinence is very common in Australia, with up to 13% of men and 37% of Australian women being affected. Amongst our older population, the prevalence of incontinence is even more widespread. The Australian Institute of Health and Welfare 2013 report on incontinence states that in 2009, 1.5% of the Australian population experienced severe incontinence, and about 1 in 14 people aged over 65 experienced incontinence. Incontinence can have a debilitating effect on the lived experience of an individual. In addition to the practical challenges and time off work, the psychosocial impact has been found to be devastating. A poor quality of life, sexual dysfunction, psychological morbidity, depression and anxiety are just some of the impacts. It is therefore vital that nurses have an understanding of the clinical aspects of the condition, particularly for those in the primary, community and aged care sectors. They need to have an understanding of the strategies and approaches to assess and manage incontinence. This course will cover the structure of the urinary system, incontinence and neural control of continence, the use and interpretation of bladder diaries, management strategies, and post-void residuals and performing bladder scans. On completion of this course, participants will be able to complete a urinary continence assessment to identify bladder symptoms and recognise when further investigations are warranted. Interpret data from a bladder diary to differentiate between abnormal and normal voiding patterns, and demonstrate the correct use of a bladder scanner, including interpretation of the results, and identify the need for referral to a doctor or continence clinic. This is vital knowledge and a great refresher course for nurses that may be exposed to clients experiencing incontinence.